Do you ever lay in bed all night, maybe just staring at the ceiling, wondering if sleep will come? If that sounds like you, you're in the right place. My name is Dr. Val, an integrative sleep medicine physician, here to talk about why women in midlife, those going through perimenopause or menopause, can have difficulty with their sleep and potentially even insomnia. So let's break it down. What is insomnia? Insomnia is a medical sleep condition where you have difficulty either falling asleep, staying asleep, and it's associated with daytime symptoms, maybe such as headache, feeling fatigued, tired, some cognitive concerns with memory, focus, or attention. And if it happens for at least 3 nights a week, more than 3 months, and it's not due to a medical condition, then we consider this chronic insomnia. If you're going through menopause or perimenopause, certainly changes in sex hormones can play a role. Sometimes we have these things called hot flashes, and if it happens at night, I'm sure you know, and it's a big concern why women have difficulty sleeping. Sometimes you wake up just so drenched. I've heard that women have to change their clothes, even change some of their pillowcases in their sheets because they get so drenched. Luckily, there's a lot of good treatment options for that. Other women have hard time falling asleep or even staying asleep because their mind is constantly going and going. We call this ruminating thoughts. As we go through this change, we can have issues with things like anxiety or depression, which can have a bidirectional relationship with our sleep. If we don't sleep well, our emotions are affected, and we can have more depression and certainly more anxiety. And if we have anxiety or depression, it can impact our ability to go to sleep. So addressing both is really important. Sometimes there's some physical concerns, and it runs within the realm of medical sleep conditions, something known as obstructive sleep apnea, when someone can have difficulty breathing at night. And that can be due to just getting older, where your muscles just aren't as strong in your upper airway. And even there are hormone-related changes that can lead to this. We know that rates of obstructive sleep apnea double to even triple as women go through some of these changes. Another thing that can happen is circadian rhythm issues. Sometimes we're just night owls trying to live a day person's life. And the way that this comes about is maybe during the week, we have to get up early for work. You're trying to sleep between 9 or 10, but on the weekends, you sort of relax your schedule and then you don't go to bed until after midnight or even 1 or 2 a.m. And then the cycle repeats itself every time the work week starts again, and that can be super frustrating. And that's actually a circadian rhythm issue. There are other things that can impact our sleep beyond what's going on with our own physical body or our mind. Our environment certainly can play a role. As we're getting older, maybe our bed partners are getting older and they're starting to snore, and that can be disruptive for our sleep. Temperature changes, whether it's too hot or too cold, can certainly impact your ability to fall asleep. Sometimes we're just light sleepers and the dog from the neighbor across the street is barking, or there's a light coming through from, the street lamp outside, and that can impact your ability to fall asleep or even stay asleep. There are so many different factors that impacts a woman's ability to fall asleep and stay asleep. And I would encourage you to just take a look at what potentially could be happening in your own life. To learn more potential reasons why women have difficulty sleeping during midlife, perimenopause, and menopause, subscribe to watch and learn more.